There are a few phases to chiropractic care, and if you've been around chiropractic for any length of time, maybe you recognize these. The first phase is usually acute care or pain relief care. This is the patient who has just suddenly an episode of lower back pain. It just feels like it came out of nowhere. It's got them down for 2-3 days. Work is either impossible or really hard, and they finally realize, man, I need to do something. And so we see a lot of those people as new patients who have pain that's just so intense and so bothersome that they need a fairly immediate solution. A lot of those people will stick around and do the work necessary to try to correct the condition that brought on that episode of pain. Some folks are content to just feel better, and then I won't see them again till the next time something hurts bad. But a lot of people will stick around for what we would call a corrective schedule of care. The intent there is, let's see if we can minimize the causative things. Can we restore healthy motion to the spine? Can we free up the nervous system so that the body can heal a little bit better and more completely? Beyond that, typically we'll taper your care out toward more of what we would call like a retainer. So like if you had braces on your teeth, and whenever you get braces off your teeth, you wind up in a retainer. The purpose is to make sure that the correction that you achieved with the braces you don't lose it. Your teeth don't just kind of slide back to where they came from. And while it's not the same thing, it's a great analogy in chiropractic. Periodic care after that period of correction will help make sure that things stabilize and that the wheels don't fall off. We don't want to see you spend time and money and energy getting better and then fall apart again. Beyond that, we start talking about maintenance care or preventative care. And this is, to me, where it starts really to be cool. Patients start saying, I just feel better. I sleep better. I'm not using pain medication anymore. I seem to be, more resilient. My brain seems clearer. My workouts are going better. I'm not so stiff in the morning. All of these things. And then the neat thing is people start saying, I wonder if this sort of care would be good for my husband or my wife. And we start seeing people referring spouses, and frankly, then a lot of times their kids